Hello, this is Dr. Kim Jeongil. Today, we will look at what is individualized orthodontic treatment for each patient. In craniofacial biology, the goals and objectives of the genetic and possible paradigms are completely different. If the craniofacial biology is determined by the genetic paradigm, we will approach genetic therapy. However, other factors will be considered if the craniofacial biology is determined by the functional paradigm. Individualized orthodontic treatment is required, but this is not so easy. This is because the patient's malocclusion pattern is diverse and complex. Even with identical twins, the two patients do not have the same malocclusion. These patients are twins, and the skeletal pattern is similar. However, the lip canting is similar to the upward direction in the right side, but patient B is more severe. All of these patients are Class 1, normal UOP, and normal POP. However, as the teeth erupt, the severity of anterior crowding is different. Patient A is not severely crowded, but patient B has severe upper and lower anterior crowding. Patient A can receive non-extraction treatment, but patient B has a high possibility of extraction treatment. Dr. Neretto did a study on the occlusal plane. He studied the occlusal plane associated with the skeletal pattern of the mixed dentition. He studied 714 untreated mixed dentition patients. He also said that the occlusal plane of Class 2 malocclusion is steep and that of Class 3 is flat. However, it is said that there are significant variations for each individual. Class 2 malocclusion was 54.3%, Class 1 malocclusion 38.5%, and Class 3 malocclusion was 7.1%. Even in Class 2, malocclusion patterns are diverse. The most common pattern is when the maxilla is normal, but the mandible is located posteriorly. In the second, there are the maxillary protrusion and the normal mandibular position. And the third is the maxillary and the mandible is in the posterior position. Fourth, the anterior position of the maxilla and mandible varies. Let's look at the occlusal plane perspective. POP and LOP in Class 2 are steep. Class 3 has a flat occlusal plane. However, some Class 2 patients may show normal LOP, and some 3 patients may show more steep. Let's review it again. It is said that the steep POP is closely related to the posterior position of the mandible, and flat POP and LOP are related to the Class 3 malocclusion where the mandible is located anteriorly. This patient has 7 degrees of UOP and 10 degrees of POP. This patient has normal UOP with 12 degrees and 16 degrees of steep POP. When we diagnose patients with protrusions, many people make routine treatment plan. What is routine orthodontic treatment? Yuan to FH, 136 degrees, Loan to MP, 99 degrees, IIA is 100 degrees, and we will try to extract the upper and lower first premolar. and to retract the anterior teeth to the posterior as much as possible. But what is different about customized orthodontic treatment? First, we look at the patient's skeletal pattern through ODI, APDI, and CF and observe the yawn to lip line, UOP, and POP. This is an 11-year-old male patient. He came to the hospital as upper anterior protrusion. What is a routine treatment plan? Since the upper jaw is protruded, only the upper first premolar will be able to be extracted. What would be the patient's individualized orthodontic treatment? First, look at the skeletal pattern of ODI, APDI, and CF. This patient is Class 2 low angle. Class 2 low angle patients mean that the mandible is more likely to be positioned forward while growing. Therefore, this patient received non-extraction treatment, and after treatment, good results were obtained. If this patient had a premolar tooth extraction, what would it look like? Let's look at Class 2 malocclusion. The occlusal plane of Class 2 malocclusion can be divided into steep UOP, normal UOP and normal POP, normal UOP and steep POP. This is a steep UOP in Class 2 patient. The patient below had a UOP of 19.1 degrees and a POP of 15.8 degrees, and showed protrusive lips and was treated for extraction. The above patient had a UOP of 17.9 degrees and a POP of 15.9 degrees, and had good aesthetics and was treated without extraction. These are Class 2 malocclusion patients with normal UOP and normal POP. The above patient has 7 degrees of UOP and 12 degrees of POP. And the below patient has 12 degrees of UOP and 11 degrees of POP. The patient below was treated with extraction. These are Class 2 malocclusion patients with normal UOP and steep POP. The above patient had 12 degrees of UOP and 18 degrees of POP and was treated with non-extraction. The below patient had 11 degrees of UOP and 18 degrees of POP and was treated with extraction. How can we set the treatment plan in such cases? Let's take a deep bite malocclusion. Deep bite malocclusion is probably what everyone wants to do with non-extraction. In the conventional routine treatment, the maxillary anterior teeth will be intruded, and the maxillary posterior teeth should not be extruded. Therefore, TPI or mini screws will be used to treat them. Therefore, when the maxillary anterior teeth are depressed, the UOP rotates counterclockwise. Let's look at the individualized treatment plan. The maxillary anterior teeth are intruded by 18 degrees of UOP, and the UOP is rotated counterclockwise by extruding the maxillary posterior teeth. The diagnosis is similar, but the treatment direction is slightly different. Individualized treatment plan considers a number of factors, such as whether to extract teeth or not, which teeth to extract and how to treat them. To diagnose these issues, self-analysis, model analysis, and aesthetic analysis are essential. The first thing to consider when doing this is understanding the patient's given skeletal pattern. This is because the teeth must be arranged within the skeletal pattern of a given patient. Therefore, it is important to determine extraction and non-extraction according to the skeletal pattern of a given patient, and determine which tooth to extract and how to treat it through Ceph model and aesthetic analysis. Skeletal analysis was also performed in conventional orthodontics. SNA, SNB, and ANB were measured by anteroposterior analysis, and the mandibular plane and SN to FH plane by vertical analysis were measured. MEAW orthodontics measures a PDI for anteroposterior analysis, ODI for vertical analysis, and combination factors CF, so you can see a triangle consisting of a palatal plane, AB plane, and a mandibular plane as shown in the picture. On the other hand, when in the conventional orthodontics, the anteroposterior position and the vertical position can be roughly known, but the dental work is not easy to understand. In MEAW orthodontics, the AB maxillomandibular triangle, consisting of palatal plane, AB plane, and mandibular plane, can analyze the skeletal patterns through ODI, APDI, and CF, and can analyze even dental pattern by yawn to lip line, UOP, and POP. Therefore, the goal of treatment is how to arrange the teeth within this AB maxillomandibular triangle of different patients. In the case of full dentures, it is easy to arrange artificial teeth because there are no teeth. However, it is important to consider the patient's AB maxillomandibular triangle first, because natural dentition has limited tooth movement. The first areas to be observed in the AB maxillomandibular triangle are ODI, APDI, and CF, and the inclination of the palatal plane of the maxilla is evaluated. Next, you can find out the state of the occlusal plane, the state of the mandibular plane angle, and the state of the anteroposterior malocclusion. In other words, through ODI, which is the angle of AB to mandibular plane, and APDI, which is the angle of AB to palatal plane, you can know the anteroposterior and vertical analysis. We set goals before we begin orthodontic treatment. In Ceph, yawn to lip line, that is, the position of the maxillary incisors, appropriate overbite, overjet, UOP, and POP settings. The mandibular posterior teeth are uprighted so that the POP can change according to the UOP. In the model, the midline of the maxilla should coincide with the facial midline. This is determined by looking at the frontal photograph and the PI view. The maxillary canine position should be symmetrical. Next, look at the UOP and set the direction of orthodontic treatment that matches the Class 1 canine relationship. There are various types of malocclusion, such as open bite, deep bite, Class 3, Class 2, Class 1, and midline deviation. We must see the patient's skeletal pattern first, not the malocclusion itself, and then look at the dental pattern. At this time, the occlusal plane is largely considered to be three types: normal UOP and normal POP, normal UOP and steep POP, and steep UOP. The skeletal pattern is used to determine whether to extract teeth or not. and which teeth to extract and which treatments are performed are determined by the position of the maxillary incisors and the occlusal plane. Therefore, to reorganize, Class 1, Class 2, and Class 3 are classified first, and the high angle and low angle of malocclusion are classified respectively. Dentally classifies yawn to lip line and occlusal plane, and so on, and determines whether to extract teeth through the analysis. Determining which teeth to extract and which treatments are used is a personalized orthodontic treatment customized to each individual patient. Thank you for watching.